Missing Food is founded by Cecilia Gautama. It was created when COVID-19 was declared a pandemic, and Singapore decided to impose a circuit breaker. As a result, citizens were irrationally buying goods, fearing that Singapore's stockpile is going to run out, because 90% of goods are imported, according to CNA. In Singapore society, there's an acknowledgeable problem of elderly poverty, which are the ones who suffer the most through panic buying and finances. Missing Food's mission is to give food care packages that include fresh produce every week to maintain the mental health of the elderly because of finances and limited supply of food due to elderly poverty and struggles in Singapore's society. Our social enterprise is to help senior citizens who are impacted by the consequences of not being able to afford or to have access to food as a result of panic buying, loss of job, low savings, or health safety. Our purpose is not only to help the elderly community but also to help them have a better mental health over their worries of finances. According to Asian Today, in 2015, Singapore has its high percentage of 40% of elderly aged 65 to 69 that are still being employed, and 1 out of 4 elders are still being employed today. According to the Blue and Gold, from the last few years, the statistics of the employed seniors have increased by 3 times more. These statistics prove that there's a sign of elderly poverty, as they're not retiring. In contrast, if the seniors don't work, they will be in elderly poverty, due to Singapore being in a high economical valued country. During the circuit breaker, the elderly population income is affected, as all of their jobs consist of manual labor, which takes place at their job facility. Therefore, there's a lost source of income due to the circuit breaker affecting the job. The major reason of elderly poverty is because lack of modern education the elderly to take on a higher wage job. In a Straits Times interview, Singapore Trade and Industry Minister Chang Cheng-sung said that the current food disruption is not the amount of food being imported, and is actually the consequences of panic buying. This is because it's only restocked on a certain time. A vegetable seller from CNA Insider claims that the demand has risen 50 to 70% because of panic buying, which resulted in increased price of goods, according to Singapore Food Agency. This proves that there's no disruption in the food supply chain, as Singapore has multiple sources globally and is actually the impact of our actions. During the circuit breaker, the elderly population is affected, as since some are in elderly poverty, the increased price of goods might not be affordable. Another factor is being homebound. The government placed this order to secure the hospital flow of patients, as seniors are more susceptible to developing symptoms which can be easily fatal. As a person ages, their immunity system starts to deteriorate slowly, and in addition, they have health conditions which are harder to treat. By establishing the social enterprise, not only will the elders be more stable financially and mentally, but the hospital will have a decreased number of elderly patients, which are harder to treat. According to WebMD, elderly have a lower immunity system, which makes their symptoms worse. Therefore, they'll require more equipment, such as ventilators, which are currently limited in the world. From the help of RAISE, we would like a financial funding start, which covers the donations when the social enterprise is new. This is because the social enterprise is run by sustainable donations received from our website. Therefore, the fund will help us start paying off the fresh produce, gasoline, and warehouse before the donations comes in. Publicity will also be needed to make the donation at a sustainable rate and to acknowledge the elderly. Therefore, the business needs to be purposeful from how big the platform is, from the donations and the publicity it receives. Thank you for listening. These are my citations.